Did you happen to put the cholesterol level printed on your health checkup results in a drawer, pretending not to know? Are you aware that the fat in your blood could be create time bomb for a heart attack or stroke right now? I haven't taken any medication, but does my bad cholesterol LDL level always show red light just from the blood test? The moment you resign yourself to the thought that it's because of family history, so there's nothing I can do. There is more than an 80% risk that your vascular age is over 20 years older than your actual age. Many people think that hyperlipidemia can only be solved with medication. But this is only half of the story. Cholesterol levels have a strong resilience that can be lowered through our eating habits, activity levels, and stress management. Today, this video will clean your blood vessels as clean as a steel pipe. We simply do not recommend medication. We will fully disclose the scientifically proven C.C.M secret solution that completely cures hyperlipidemia without medication and helps you escape the risks of myocardial infarction and stroke, along with specific diet and exercise methods. The moment you change the channel right now, you will miss 7 deadly habits that damage your blood vessels. Stay focused until the end and start your project to rejuvenate your blood vessels. Part 1. Ubuntu. The truth about hyperlipidemia. Is cholesterol really a bad substance? 1. Misconceptions and truths about cholesterol. Before discussing hyperlipidemia, we need to clarify some misconceptions about cholesterol. Cholesterol is not a bad substance at all. It is an essential component of life that our bodies need. The bricks of the cell membrane. Cholesterol is an essential component that makes up the cell membrane surrounding the countless cells in our body. Raw materials for hormones. It is a key ingredient for producing important hormones, such as male hormones, female hormones, and vitamin D, as well as bile acids. The issue is not the amount of cholesterol, but how it is transported and processed in our bodies. It's like a delivery system. 2, 3 major risk factors in the blood: LDL, HDL, triglycerides. LDL, bad delivery. It is the delivery that transports cholesterol from the liver to the cells. If there is too much fat, it becomes a major culprit that builds up on the walls of blood vessels and causes arteriosclerosis. It is called bad cholesterol. It is important to maintain below 130 milligrams per deciliter. HDL, good janitor. It is a janitor that retrieves excess cholesterol left in the cells back to the liver, cleaning the blood vessels. The higher the value, the lower the risk of cardiovascular disease. It is called good cholesterol. It is recommended to be above 40 milligrams per deciliter for men and 50 milligrams per deciliter for women. Triglycerides, energy reserves. They are a major energy source for our body, and the calories that are not used are stored in the form of fat. High triglycerides can worsen the properties of LDL and increase the risk of pancreatitis. The main culprit of this is excess carbohydrates. It should be kept below 150 milligrams per deciliter. 3. Hyperlipidemia. Why is it called the silent killer? The most frightening aspect of hyperlipidemia is that there are no initial symptoms at all. There is no pain until the blood vessels are 70 to 80% blocked. However, once a problem arises, it can lead to life-threatening complications such as heart attacks and strokes. This is like a water pipe quietly rusting and narrowing. It suddenly bursts out. Therefore, even if there are no symptoms, LDL levels and triglyceride levels must be thoroughly managed through regular checkups. Part 2. 3 unexpected causes of the death fat that blocks blood vessels. 80% of hyperlipidemia is due to lifestyle habits that we repeat every day, not genetics. Revealing the deadly cause that blocks blood vessels. 1. The worst fat that skyrockets LDL levels. The betrayal of trans fats. The fats you need to be most cautious about are trans fats. They are found in margarine, bread with shortening, cookies, fried foods, and processed foods. Trans fats increase LDL and decrease good HDL, having a dual negative effect that accelerates cardiovascular disease. Do not consume trans fats at all. The risks of saturated fat. Saturated fats found in animal fats, such as pork belly fat, butter, and cheese, also increase LDL levels. Moderate amounts are fine, but excessive intake should be avoided. 2. The trap of carbohydrates that skyrockets triglycerides. The real culprit of triglycerides. Many people think that fat is the main culprit of triglycerides, but in fact, it is the excessive intake of carbohydrates. Refined carbohydrates, especially white rice, white bread, sugar, and liquid fructose, are absorbed quickly, raising blood sugar levels, and the remaining energy is converted into triglycerides in the liver and stored. Sweet poison, liquid fructose. The high amounts of liquid fructose found in carbonated drinks, juices, and processed foods are the most dangerous ingredient that can explosively raise triglyceride levels. This is the top priority that needs to be cut off immediately. 3. Lazy habits that disrupt cholesterol metabolism. Lack of exercise. Lack of exercise is the biggest cause of lowering good cholesterol levels, known as HDL. HDL can only be effectively increased through exercise. Chronic stress and lack of sleep. When stress increases, our body releases a stress hormone called cortisol, which affects the levels of cholesterol and triglycerides. Without sufficient sleep, fat metabolism function declines. If you know someone around you who is taking medication for hyperlipidemia or is worried about their cholesterol levels, please share this video so we can all be healthier together. Please convey the hope that it can be managed well without medication. Part 3. C.C.M. solution that turns blood vessels into steel pipes without medication. From now on, we will specifically introduce the scientifically proven C.C.M. diet, exercise mind secret solution that can help you stop or reduce your medication for hyperlipidemia. First, C1, the miraculous eating habits that lower LDL and raise HDL. The power of good fats, unsaturated fats. Consume blue fish like mackerel and salmon, which are rich in omega-3, as well as olive oil and nuts, walnuts, almonds. They are effective in lowering LDL and raising HDL. Cleaning ability of soluble fiber. Foods rich in soluble fiber, such as oats, brown rice, legumes, apples, and seaweed, are excellent at preventing cholesterol absorption in the intestines and lowering LDL levels. Replace with good carbohydrates. To manage triglycerides, eat brown rice or mixed grain rice instead of white rice. And try to base one meal a day on vegetables and protein instead of bread or noodles. The importance of order during meals, eating in the order of vegetables. Protein carbohydrates helps prevent blood sugar spikes and reduces the production of triglycerides. Second, C2, the golden exercise principle for maximizing HDL. Essential for aerobic exercise, activities like brisk walking, jogging, and swimming are the most effective for burning triglycerides. Exercise consistently for at least 30 minutes, 5 days a week, to the point of sweating. High-intensity exercise to raise HDL. Research shows that interval training with short bursts of high intensity is very effective in increasing HDL levels. Combining aerobic exercise with strength training is the best of both worlds. Increasing movement in daily life. Aim to walk more than 7,000 steps a day. Use stairs instead of elevators, and completely eliminate lazy habits. This is the most important information for your vascular health. Please press subscribe and like so that more people can escape the risk of hyperlipidemia. We support your healthy old age. Third M, mind control to reduce vascular stress. Stress management. Find your own way to relieve stress, such as meditation or hobbies, to lower cortisol levels. Stress is a deadly toxin that causes inflammation in the blood vessels. Sufficient sleep. Ensure you get 7-8 hours of adequate sleep every night to help your metabolism and fat metabolism function normally. Part 4. When is the golden time to take medication for hyperlipidemia? No matter how hard you try, there comes a point when medication treatment is necessary. When should I start taking medication? And what are the misconceptions and truths about statin drugs? 1. The golden time when medication treatment should begin. Priority treatment targets. High-risk groups who have already experienced cardiovascular diseases such as myocardial infarction or stroke, or have other risk factors like diabetes or hypertension, should start medication immediately regardless of LDL levels. If lifestyle changes fail, if, despite consistently working on lifestyle modifications for 3 to 6 months, Your LDL levels do not drop below the target level, you should consider medication. 2. Misconceptions and truths about statin drugs. Misunderstanding 1. Once you start taking statins, you have to take them for life. Truth. If cholesterol levels are sufficiently lowered through lifestyle changes and the risk level is deemed low by a doctor, the dosage can be reduced or discontinued. However, it is common to maintain high-risk groups to prevent recurrence. Misunderstanding 2. Statin medications have serious side effects. Truth. Statins are one of the most effective medications, but some patients may experience side effects such as muscle pain or abnormal liver function tests. However, this is rare, and you can adjust the dosage or switch to another medication through consultation with a specialist. The benefits of the medication far outweigh the risks. 3. Check your vascular age through regular checkups. Managing hyperlipidemia is not just about looking at the numbers. We need to check how far the arteriosclerosis has actually progressed. Carotid ultrasound. The carotid artery in the neck best shows the condition of the blood vessels. We need to measure the thickness of the vascular wall, IMT, through ultrasound and check for the presence of plaque, fat deposits to assess the actual vascular age. Setting LDL target levels. The LDL target level varies depending on the patient's risk factors, such as diabetes, smoking status, etc. I need to discuss with my doctor to set and manage my target LDL level. Part 5. Final check for lifelong vascular health and hope message. Hyperlipidemia is a condition that can be fully overcome with consistent attention and effort. Recognize the dangers of trans fats and refined carbohydrates learned today, and make a diet rich in omega-3 and fiber. Along with aerobic exercise, a habit in your life, your efforts will never betray your cholesterol levels. Avoid relying on medication and create healthy blood vessels on your own to escape the fear of myocardial infarction and stroke. Your vascular youth is not over yet. If you have any questions or experiences about improving vascular health, please leave a comment and I will return with more useful health information in the next video. Thank you.